So what are antidepressants and how do they work? Antidepressants are usually taken by those who have depression. What exactly is depression? Depression is a common mental illness that causes feelings of sadness and/or a loss of interest in activities once enjoyed. Well-known antidepressants that are prescribed are Prozac and Paxil. These are the antidepressants that are usually given, Paxil and Prozac. They're also known as SSRIs. And they make you go from sad to happy. This is how someone feels before taking antidepressants. Serotonin plays an important role in depression, so when someone has low levels of this neurotransmitter, it is more likely that they will feel sad. So let's take a look at what is inside the brain. So here we have a presynaptic neuron and a postsynaptic neuron, simply nerve cells. The gap between these two neurons is known as the synapse. Now, as the nerve impulse is traveling down the axon terminal to the nerve ending of this presynaptic neuron, it will trigger the release of serotonin via the use of neurotransmitters. These neurotransmitters found at the nerve endings will release serotonin into the synapse. Now, once serotonin is floating around within this synapse, it will either bind to serotonin receptors on the postsynaptic neuron, or some of it can get reabsorbed by serotonin reuptake transporter, which are on the surface of the presynaptic neuron. Now, when enough serotonin is received by the postsynaptic neuron, the message can then move forward and create positive effects on a person's mood. For those with depression, not a lot of serotonin is available to be released and received by the postsynaptic neuron. This can interfere with the message being sent and quite often results in symptoms of depression. SSRIs are antidepressants. They stand for selective serotonin reuptake inhibitors. The main effect is to reduce or block the reabsorption of reuptake of serotonin by the presynaptic neuron. So the SSRI will travel to the synapse between these neurons and will attach or bind itself to the serotonin reuptake transporters on the surface of the presynaptic neuron, and essentially it will block the serotonin from being sucked back up into that presynaptic neuron. By doing this, serotonin levels within the synapse will increase, leaving more serotonin free to stimulate the receptors on the postsynaptic neuron, and this will leave a person feeling happy. So these are the results after taking antidepressants. This person was sad and is now happy.
So what is promethazine codeine? It is a cold medication, antihistamine, and narcotic, sleeping-inducing drug derived from morphine. So here we have an example of someone who is sick and is in need of promethazine codeine. So what is promethazine codeine used for? It is to treat cough, runny, stuffed nose caused from flu, allergy, or common cold. So how do you get promethazine codeine? It must be through a prescription from a doctor if needed, and cannot be found over the counter, and is not a normal medication that can be found in any drugstores. So how much is the dosage for promethazine codeine? If greater than 12 years old, 5 millimeters, 30 millimeters maximum, and always use a medication measuring device. So when do you take the dosage? With or without food? Every 4 to 6 hours. Do not take with alcohol. Because if you do take it with alcohol, it can cause kidney problems. example of a person who did take it with alcohol. The person is suffering from breathing and is asking for help. So what can happen to the body and the brain? Damage. Codeine affects a certain part of the brain. Here we have an example of someone who is highly addicted to codeine. He is asking for more. However, it could be prevented. How? By following the measurement dose. So what is a dose exactly? It is a measured quantity of the therapeutic agent.
What is dextroamphetamine? Amphetamine. It is also known as Adderall.
So what is Adderall? Here we have an example of a brain, and here we are going to explain what can happen to the brain when you take Adderall. Adderall is a stimulant that increases levels of specific chemicals in the brain. It lowers frequency of fidgeting, and interrupting by those with attention deficit disorders.
Adderall is used to treat attention deficit disorders, especially attention deficit hyperactivity disorder, which is also known as ADHD. Adderall can also treat attention deficit disorder, which is ADD. What is ADHD? ADHD is a neurological disorder characterized by hyperactivity, impulsivity, and distractibility.
You can put Adderall in mainly for people with ADHD or ADD. It's supposed to keep them focused, but if you use it and you don't have ADD or ADHD, it does the opposite. So what forms does it come in? It comes in a tablet, a capsule, and lastly, in liquid form.
Is RX needed? Yes, most of the drugs that treat attention deficit disorders are derived from amphetamines or amphetamine derivatives, resulting in a highly addictive character.
So what are the side effects from taking Adderall? There's many to begin with. The first is nervousness. The second, irritability. The third is anxiety.
Tremor, dizziness, and restlessness.
Other side effects are headaches, stomach aches, decreased appetite, trouble sleeping, blurred vision, and lastly, dry mouth.
The stimulant effects. Agonist. Agonist is a drug that binds to a particular receptor site and triggers cell response in a way that is similar to the action of the body's own chemical messenger.